Good afternoon, Lindsay and Beershell. You know, Indiana is not alone in this surge. There are about 40 states who are experiencing this right now, and experts credit this increase to pandemic fatigue and people spreading the virus at gatherings. But the biggest takeaway is COVID is everywhere at this point in time, and there's no way around it.
Indiana is definitely in its second wave. There's no doubt about that.
It's the same fight, but a new season that could potentially be worse.
Especially that it's happening at a time where the weather is becoming colder and people are being forced to move more into the indoor settings.
Cases have been on the rise since September. Saturday, we hit 5,000 new cases, the highest since the start of the pandemic, and positivity rates are just shy of 10%.
Every time we follow the guidelines for CDC, we actually see a drop in the number of cases. And then every time we don't follow those guidances, we see an uptick in the number of cases.
After that uptick, health officials say there's also an increase in hospitalizations and death rates.
If we don't act soon, then we are going to, one, face a shortage of healthcare resources.
Hospitals in the state are already seeing a rise in COVID patients admitted to ICUs. Dr. Brian Dixon with the Regent Street Institute is concerned if things keep trending up, hospitals will need more options fast.
We'll have to either create more bed space, set up temporary hospitals. We will have to potentially start, definitely cutting back on elective procedures and other procedures in hospitals that will require those same beds.
Dr. Lena DeBabo with IU Methodist Hospital stresses testing needs to be done regardless of exposure or symptoms.
The sooner we can get this under control, the better we can protect our community and prevent hospitalizations and deaths from COVID. So we really need to be acting on this fast.
Now, again, we cannot say this enough. You heard from the health experts right there in that story. Continue to follow the CDC guidelines. That means wearing a mask. That also means remaining socially distant and also refraining from those gatherings. They are also urging that you get tested regardless of exposure or symptoms. Now, for those of you who may be planning Thanksgiving at this time, with the increase in cases, those should be limited to no more than one household at a table. That's the very latest in the newsroom this evening. I'm Darius Johnson, Fox 59 News.
Thanks so much, Darius.